Greetings dear viewers. In this video, I would like to explain about the adenoviruses. This is a continuation of my part 1 previously uploaded video of adenoviruses. In that, I have explained about the general characteristics of adenoviruses, its structure, mode of transmission, pathogenicity and replication pattern. In this video, I would like to explain about the clinical symptoms, lab diagnosis and treatment of adenoviruses. I am Dr. M. Manigandan, Assistant Professor from the Department of Microbiology, Sacred Heart College, Tirupattur. Clinical syndromes of adenoviruses. The clinical manifestations of adenoviruses infection vary considerably depending on three major factors. First one is the infecting adenoviruses serotype. Second is the age of patient. And third is the immune status of the host. More than 100 serotypes of adenoviruses have been identified, and different serotypes show tissue tropism, which means they preferentially infect different organs such as the respiratory tract, eyes, gastrointestinal tract, or urinary tract. Children are the most commonly affected population because they have limited pre-existing immunity. Immunocompromised individuals, including transplant recipients and patients receiving chemotherapy, may develop a severe or disseminated diseases. The first clinical symptom is the respiratory tract infections, which includes common cold and pharyngitis. Respiratory tract infections most commonly identified in children by adenoviruses. Patients usually present with symptoms similar to influenza or the common cold, including fever, sore throat, cough, nasal congestion, or runny nose. The pharynx often appears red and inflamed, leading to pharyngitis. Cervical lymph nodes may also become enlarged. These infections are particularly common in infants and young children, where the adenovirus is one of the important viral cause of upper respiratory tract infections. The second thing is the pharyngoconjunctival fever. The pharyngoconjunctival fever is one of the classical syndromes caused by adenoviruses. It is characterized by a triad of fever, pharyngitis, and conjunctivitis. This transmission occurs through the contaminated water, respiratory droplets, or direct contact. The syndrome frequently occurs in outbreaks among school children, summer camps, and the swimming pool because of the adenoviruses remains infectious in inadequately chlorinated water. The clinical presentations are high fever, severe sore throat, red watery eyes, swollen eyelids, enlarged lymph nodes. Next thing is the acute respiratory disease, which is a more severe respiratory infection. The patients may develop high fever, persistent cough, severe sore throat, fatigue, difficulty in breathing. And the primary serotypes responsible for this infection are adenovirus types 4 and 7. And next is the pneumonia, which means infection in our lungs in some individuals, especially infants and elderly people and immunocompromised patients. The adenovirus can spread into lower respiratory tract, causing adenoviral pneumonia. The lungs become inflamed, leading to impaired oxygen exchange. The clinical features include high fever, severe cough, shortness of breath, chest pain, and low oxygen saturation. In conjunctival infection, the ocular infections like follicular conjunctivitis, epidemic keratoconjunctivitis are common in this infection. So, in follicular conjunctivitis, which is commonly known as pink eye, the patients will experience red eyes, excessive tearing, foreign body sensation, mild pain, swollen conjunctiva. The follicles may appear as small nodules beneath the conjunctival surface. This is highly contagious. The infection usually resolves spontaneously within 1 to 2 weeks. The transmission modes are eye to eye, hand to eye contact, contaminated towels, ophthalmic instruments, swimming pools. The epidemic keratoconjunctivitis is one of the much more severe ocular infection. Unlike simple conjunctivitis, this disease often affects both conjunctiva and cornea, which includes severe eye pain, photophobia, blurred vision, excessive tearing. Epidemic keratoconjunctivitis is extremely contagious and frequently causes outbreaks in eye clinics and hospitals. The adenoviruses also causes gastrointestinal and genitourinary tract infections. In gastroenteritis, the adenovirus serotypes 40 and 41 infects the gastrointestinal tract, and this majorly causes childhood diarrhea worldwide with symptoms like watery diarrhea, vomiting, fever, and dehydration. Unlike the rotavirus infections, adenoviral diarrhea may persist for several days. And regarding this hemorrhagic cystitis, that is in the urinary bladder, adenoviruses causes infection that results in the inflammation and leads to hemorrhagic cystitis characterized by painful urination, frequent urination, and blood in urine. The disease occurs primarily in young boys and immunocompromised patients. The third important thing in urinary bladder is the infection that leads to cervicitis and urethritis. The adenoviruses occasionally infects the genital tract. Inflammations of the cervix causes cervicitis, and inflammations of the urethra produce urethritis. The patients may experience pain during urination, urethral discharge, and pelvic discomfort. Although this is less common, adenoviruses should be considered among viral causes of these conditions. To identify the adenoviral infections, accurate laboratory diagnosis is essential because adenovirus symptoms resembles those of influenza, respiratory syncytial viruses, COVID-19 viral infections, enteroviruses, and bacterial infections. Diagnosis depends upon the clinical syndrome and specimen collected. So the specimens are including nasopharyngeal swab, throat swab, conjunctival swab, stool sample, urine, and blood. So this specimen should be always be collected from the site of infections, and this one greatly improves diagnostic accuracy. The first detection technique is the PCR polymerase chain reaction, which is a golden standard for adenoviral diagnosis. So it detects viral DNA directly, and the second is the antigen detection, that is rapid antigen detection methods including ELISA, immunofluorescence assay, and historically adenoviruses were isolated by cell culture using the susceptible cell lines such as human embryonic kidney cells, HeLa cells, A549 lung carcinoma cells. So during this viral cultivation, the cells may be observed with the cytopathic effects including syncytia formation, cell enlargement, cell clumping, and cell lysis. Although these are all highly specific, culture is slow and mainly used in research laboratories. Serologically, tests like ELISA and neutralization helps us to identify antibodies produced against adenoviruses. The serological identification is mainly useful for epidemiological investigations, serotype identification, population immunity studies, and this one has limited value for diagnosing acute infections. And also to view the viral structure, we use electron microscopy and we can identify the icosahedral symmetry, and which is approximately of about 90 to 100 nanometer in diameter. Regarding the treatment of adenoviral infections, there is currently no universally approved antiviral drug for adenovirus infections in otherwise healthy individuals. Most infections resolve spontaneously. The major important thing is the supportive care. Patients should receive adequate hydration, antipyretics for fever, analgesics for pain, and requires plenty of rest with nutritional support. Children with diarrhea require oral rehydration therapy. And regarding the antiviral therapy, uh, in immunocompromised patients, antiviral drugs may be considered like cidofovir, which inhibits viral DNA polymerase. This is also limited because it can cause severe kidney toxicity, and this is generally reserved for life-threatening infections. For prevention and control, adenovirus transmission is extremely important because the virus survives for longer periods on environmental surfaces. So we should have frequent hand washing technique we should use. Then respiratory hygiene, isolation of infected patient, cleaning contaminated surfaces, avoiding sharing of towels and eye cosmetics. And to prevent the infection, disinfection is also one major thing to follow. So the effective disinfectants include sodium hypochlorite, peracetic acid, accelerated hydrogen peroxide. These agents extensively inactivate the viral particle on surfaces and medical instruments. Regarding the vaccination, a live oral adenoviral vaccine is available, which contains serotypes 4 and 7. This vaccine is used almost exclusively for military recruits to prevent acute respiratory disease. Currently, there is no licensed adenoviral vaccine for general population. Thank you for your patient listening. Kindly support us by giving your valuable comments and encourage us by subscribing to our channel. And thank you again.